All right, we are live for National Health Professions Week. We just want to thank everyone for joining us for this week of Career Connections. This week is dedicated to teaching students about different careers in the healthcare professions. We want to make a special thank you to Dayton Children's Hospital for helping us put together this fantastic panel. We're excited for all of the hard work that the Greater Dayton Hospital Association has put in, and all of our other partners. My name is Brian Stewart, and I work for Learn to Earn Dayton in the Montgomery County Educational Service Center. And we're just so excited to bring students from across our region, speakers, to come and talk about their careers. So with me, I have Madison Jaworski. She's in AmeriCorps Vista, and she's working with the Dayton Regional STEM Center, and she's going to lead the next 40 minutes of panel discussion. We're going to kick it off speaking with Hilary O'Neill, who's a respiratory therapist. So without further ado, Madison, I'm going to turn it over to you. And Hilary, we can't wait to hear from you.
Thanks, Brian. So I am going to be leading our panel this morning. And again, Hilary, we just want to thank you for being here. And I know that we're waiting on a couple other people, so hopefully we should be able to get a couple more people to answer some questions here soon. But we can just go ahead and start off if you're okay with that. And our first question is, can you just tell us what your position is and what you sort of do on a day-to-day basis? Uh-oh, looks like we have some freezing, maybe?
Hilary, it looks like you might be muted. Are you there?
Oh no.
We'll see if Casey can hop in and do a little introduction from Dayton Children's while we wait. And it wouldn't be a live event without a few hiccups along the way. So as we wait for folks to join us, we just want to say thank you to everyone watching, either now live or maybe later in the future. And this is just a reminder that this entire week is dedicated to making sure that you learn about different careers in healthcare and bioscience. And it looks like Hilary's back. Hilary, are you there?
Yes, I am. I went to talk and all of a sudden my screen went dark.
We're glad you're back.
So did you hear our question? You need me to repeat it?
Go ahead and repeat it.
Sure, yeah. So the first question is, can you tell us what your position is and what you do on a day-to-day basis?
So I'm a respiratory therapist. Actually at Dayton Children's, I'm one of the managers in the respiratory therapy department, but I've worked in several different departments throughout the hospital. So respiratory therapists, especially at Dayton Children's, so we work kind of everywhere throughout the hospital. So all the different departments, in the ER, in the ICUs. So when one of my favorite places to work was in the pediatric ICU. So we would start a day by getting information from the therapist who was there overnight. So, we run a 24-hour operation. So it's always, kind of switching back and forth between who was at night and during the day, and then get all the information about the patients that we have. And then we always, check on the most critical patients first. So we go and check on ventilators, make sure all the settings are good, make sure the patients are stable. Then we would get into doing any kind of breathing treatments that we have. So whether it's just giving like nebulizer treatments or different kind of therapies that we can do to help patients kind of move any secretions out of their lungs or different things like that. And from then on, it can be kind of anything that pops up. We participate in all sorts of critical situations that go on. We, provide airway support for patients that if we're having a code or if, someone's getting really sick or any new patients that show up, whether they come in from the ER or the OR. We really participate in the care of tons of different patients just to make sure that, they're able to breathe and that we can maximize them being able to breathe the best that we can. So it's kind of cool. I mean, when you think about it, breathing is important for every patient. So that means we get to be really hands-on with every patient that's in the hospital.
Yeah, it sounds like that's really important work that you guys are doing. Thank you for sharing that with us. And it looks like we have Miss Emily Cromer on the line now as well. Go ahead.
Hi, I am filling in for Emily. Emily had an emergency, so she will be in the next session.
Okay.
So my name is Teresa, and I have a different role here at the hospital.
Okay.
So did you want to ask me some questions, or do you want me to start out and kind of tell you what it is that I do?
Sure. So we just asked Hilary what she does and sort of what a day-to-day, what your job looks like.
Okay. So I am a family partnership coordinator. It is basically, in a nutshell, I am a mom, and I have spent a lot of time in hospitals with my own children. So now it is my job and pleasure to work with our families to make sure that their voices are brought into every type of project, process, and train them and develop programs where their voices can be heard. For instance, a lot of hospitals right now, they have roles such as mine, and we are considered paid parents. So what I do is I will look for parents who have had the parents that are really the best ones to give us good feedback are ones who have had maybe a not so good experience, but we have been able to turn it around. And we want the parents to be able to think of not just their own wants and desires, but also the benefit of all of the families that we serve here at Dayton Children's. I actually work under the patient experience and patient relations umbrella. So my day-to-day activities look very different. Each day is kind of like a box of Cracker Jacks, right? I don't know what prize I'm going to get out. One day I could be focused on working on one of our hospital acquired condition committees. And those committees are focused on keeping our patients and families safe. And then there could be days where I'm focused on arranging speakers and getting some feedback and improvement projects to present to maybe our councils. We have a couple of different councils. Or I could be focused on recruiting parents and training them. The other thing that I do a lot of is I actually will follow interns and watch their interactions with families, and I will give them feedback. I will tell them what they're doing well and what they can improve on in order to make them better physicians as they move throughout their career. Because a lot of physicians like to use the medical language, and it's very difficult for our families to understand. So I will tell them, you need to be cautious of that. If you do have to use that, make sure you're giving an explanation. I also will go into different departments and watch processes and tell them where they could improve their processes from a parent perspective. Or I could be sitting in multiple meetings every day with our senior leadership. So my days can vary very, very much. Right now, I'm in the process of developing a mentorship program for our parents. And so that is something new to the hospital. And I'm also involved in working on a team where we have 9 children's hospitals that is across the United States that are involved with building resiliency with our chronically ill patients. And it's through the American Board of Pediatrics. So like I said, my day varies, but it's always very busy. And I always have a lot to learn.
It definitely sounds like it. Wow, that's a whole long list of things that you're doing there. But thank you so much for sharing with us. And it looks like maybe we have Colleen on with us now. Colleen, if you're there.
Yeah, I'm just trying to keep it from making noise.
No problem. We understand you guys are in a hospital, so it can be a little bit noisy sometimes, right? So what we have asked everybody else, and first we'd like to say thank you for joining us, but our first question for our other panelists has just been, can you tell us what you do and sort of what your day-to-day job looks like?
Yeah, so I'm Colleen Begley. I'm a pediatrician, and I work at Dayton Children's Hospital. So my job is actually, I only work at night. So I come in and I just kind of see any kids that are sick in the hospital, and then any kids who are new, like coming into the hospital, I would interview them, kind of learn what their problem is and figure out how to treat them. And then when I do that, it's me and another pediatrician on overnight, and we work with our residents who are doctors in training, and then also our medical students who are learning how to be doctors. So really the only difference between me and kind of what they would do during the day is I don't, during the day they go around and see everybody on the floor, which is called rounds. And so we don't do that overnight because everybody's sleeping.
Great. Well, thank you for sharing. It looks like we have a really great group here. Thank you all for telling us a little bit about your positions and getting on this morning. So if you all are ready, we can go ahead and move to our second question, which is, what do you wish that you had known about your field before going into it, or what do you wish others know about your field now? And Hilary, we can start with you if that's okay.
Sure. I think, honestly, I wish I would have known that when I was younger. I wish I would have known that being a respiratory therapist existed. So I feel like a lot of people know about nurses and doctors, even physical therapists and, different positions in the hospital. But respiratory therapy in general is sort of a newer profession. And so it's not something that everybody knows of or everybody grows up wanting to be. Like, I know most people I talk to, I always ask, like, well, how did you become a respiratory therapist? And everybody has some like weird story of like, well, I started doing this and then I found out about this and then I moved over here. So I wish that a lot more people would know that being a respiratory therapist is an option. And it's an exciting, really varied career. So I feel like a lot of people thinking about being a respiratory therapist, like, oh, you just give breathing treatments. But that is one thing we do, but we have our hands in so many different areas of the hospital. I think the coolest thing I would say to know about being a respiratory therapist at Dayton Children's is that we have our transport team. So what I don't know that a lot of people know is that adult hospitals can't admit pediatric patients so a lot of them aren't able to. So what our job is, we take a nurse and a respiratory therapist and go out in our ambulance to these adult hospitals and pick up kids to bring them back here. And sometimes those are really sick kids, and sometimes those are kids that aren't that sick. But it's definitely a cool opportunity to truly use our skills and be dependent on what we're taught to do and critical thinking and all of that. So I would say that would probably be it.
Thank you for sharing. I didn't know that you all did that, so that is really interesting. And it's good that you mentioned sort of learning about different careers. Obviously, that's sort of why we're doing this week. That's the point of our Health Professions Week. So just getting on here and being able to talk to students today and have them watch this later on will hopefully give them a better idea of what a respiratory therapist is with all these other jobs, and possibly help them get interested a little bit earlier.
That would be great.
All right. Teresa, would you be able to share about what you wish people would know about your career path?
Sure, absolutely. So I knew that I wanted to be in healthcare from the time I was about 16 years old. And I knew that I wanted to be what I thought I wanted to be a nurse, but then I decided I wanted to be more on the administrative side. At the end of the day, never did I ever think that I would be sharing my voice with my experiences to help make our families' experiences better. And so the one thing that I have to say to the youth is that every experience that you have is going to benefit you for the future. You have to take, even if it's a negative experience, just turn it into a positive, because you don't know where that's going to come into play in the future. I have 3 children, all with very unique and special needs, very challenging as I was raising them. But having this role, which is about 3 years old here at the hospital, is absolutely amazing, and it's a wonderful opportunity, and it's a lot of something that a lot of hospitals are doing now. They have paid parents because they know how valuable it is to have the voice of the parent around the table, because we know our children best.
Thank you for sharing. I hope all of our students are listening and take that message to heart. Colleen, would you like to share?
Sure. So I think I also kind of knew I wanted to go into healthcare from an early age. And I knew like of a pediatrician as kind of someone you saw in the clinic for your yearly visit. And so I guess I didn't realize that you can be a pediatrician in a lot of different settings. And one of them is just working in the hospital, which is a really cool job because we get to deal with like lots of different problems, lots of interesting cases. But unlike adult medicine, a lot of kids have problems that we can solve and we can send them home and get them home quickly. So it's a really happy field too. Like a lot of people get better easily, and it's just a fun environment to work in.
Yeah, definitely a lot of fun to work in a hospital. I'm sure you all see plenty of different things every day. So we actually have had a couple of people now. So in a previous survey that we did, Maddox, a 9th grader at Belmont, asked this question. And then in our live chat on YouTube, we actually just had Mr. Jaron Dale ask a very similar question. So everybody wants to know sort of what your all's educational pathway was, and sort of how long did it take you to get into these types of careers? And in order to not make Hilary have to be the first one every time, I will have asked Teresa if you wouldn't mind going first here.
Sure, absolutely. So my path was kind of a series of hills and valleys. So I also went to Belmont. So yay, Belmont. However, I was not the best at book learning. I was more the hands-on learning type person. So right after graduation, I went to college. I went to Sinclair for my first year. I went for a medical secretary, and those don't really exist anymore. They're called administrative secretaries. But I was able to get all of the medical terminology behind me and a lot of the core classes. I was struggling, and I spoke to my parents and I said, I am having a really hard time, and sorry. And if I can get a job in the field that I'm studying, I would like to not go back to college the second year. So that's what I did. I was able to get a job at a physician's office, and I've been in healthcare for the last 29 years. However, my path, as I said, I have always been that person in an office that, when you hear people say Gal Friday, they're the person that kind of do a little bit of everything. So I was that person in medical offices. And then I took a job here at Dayton Children's, started out in scheduling, worked my way up, currently in this position. And however, I had the desire, I needed to finish my degree. So I went back about 3 years ago and I completed my associates. So not everybody's path is going to look the same, but if you know exactly what you want to do, go for it. And nothing can stop you. We all have a different way that we learn. It's a matter of being passionate and knowing what you want to do with your life.
Thank you so much for sharing. I think it's definitely important for our students to know that sometimes things don't always quite go the way you expect them to, but eventually it can work out if you keep working hard and get somewhere that you really want to be. So thank you so much for sharing that. And Colleen, would you mind sharing with us your sort of educational path?
Sure. So being a doctor is kind of a little bit regimented and long. So what I did is I went to college for 4 years and I got my bachelor's degree. I actually got my degree in English. You don't have to get like a science degree. And then I went to medical school, and that is a doctorate degree, and it was another 4 years. And then after that, I was officially a doctor, but in order to like become a doctor in whatever specialty you want to do, whether it's like family practice or surgery or pediatrics, you have to do a residency. So that's kind of like on the job training. And I did that for 3 years. And I think even though there is a lot of schooling involved, not everybody goes straight through. Like I know a lot of people who took breaks between high school and college, or college and med school. So you can kind of take time off if you need it, or if you just want to do, some of my friends just did something fun, like volunteered for a year. And then, like I said, you can get like pretty much whatever bachelor's degree you want. So that's cool.
Yeah, so I didn't mention this before, but just to share a little bit along the same lines, I actually am also going to medical school next year, but I decided to take a gap year between college and going to medical school. So I'm sort of taking the little bit of a longer path that you were mentioning, but we'll get it done eventually, fingers crossed, right? And if you don't mind me asking, I was just curious where you went to medical school and where you completed your residency.
Sure. So I went to medical school at Wright State, and that's kind of how I learned about Dayton Children's. And then I did my residency at Rainbow Babies, which is in Cleveland.
Great, thank you so much. And Hilary, I will ask you to answer this question as well.
Sure. So there's a lot of different paths to becoming a respiratory therapist. So initially, you can be a respiratory therapist with an associate's degree, which is what a lot of respiratory therapists have. There are also bachelor's degree programs, and there are even master's degree programs in respiratory therapy. It all really depends what you want to do. So I actually have a bachelor's degree in biology and then a master's degree in respiratory therapy. And so when I got my bachelor's degree in biology, I knew I wanted to do something in healthcare, which led me to respiratory therapy. And then for the reason I decided to get a master's degree is because I knew I wanted to kind of further my career once I sort of got into respiratory therapy. So I've worked, with patients as a respiratory therapist, and then currently I'm working in a manager capacity. And I think I'd also like to, at some point, teach in respiratory therapy programs too, because I think that's a really cool opportunity. But to be a respiratory therapist, it's really just an associate's degree. And then from there, you can decide what you'd like to do with that.
Great, thank you. And for some of our students that are watching that may not be entirely familiar with the terminology yet, an associate's degree, and you can correct me if I am saying this wrong in any way, but an associate's degree is typically a 2-year degree, where a bachelor's degree is typically a 4-year degree, and then a master's is a degree that you would get after going for your bachelor's, and that length of time, I believe, if I'm wrong, it can sort of vary, right? I think the typical is usually 2 years, but it can be different based on what you're doing.
Yep.
Great. Thank you.
Yep, for sure.
And it just sort of worked out that all of you guys, I think it was a really great little panel that we've had here, just from the standpoint that, you all had very different educational pathways that are all sort of, showing us the various different ways. Like we've got, an extra 4 years of medical school, and we've got, 2 years associate's degrees, or a master's degree. So thank you all for sharing. There's a lot of different timelines that you can go into medicine with. So for students that are interested, that's something that I think is very useful for them to know. So I think we can move on to our next question, which is, what do you think makes healthcare a special field? And Colleen, I will have you go first this time, if that's okay with you.
So I think I really like healthcare and being a doctor because it just kind of combines a lot of different things. So there's really interesting science, is learning about diseases and how they happen and then how you treat them. And then there's also the part where you actually get to interact and talk to people. So it's kind of a mix of like a humanities and science, if you will, kind of learning people's stories and how that plays into their disease. So I just like it because it kind of is everything I'm interested in, like other people and science.
You can get everything in healthcare. Thank you for sharing that. And Hilary, would you mind sharing why you think healthcare is a special field to be in?
Yeah, I think healthcare is really cool because it's not just one thing. Like, I feel like we all, grow up knowing, you go to the doctor when you don't feel good and all of that, but healthcare is so broad and varied. You can work in a doctor's office, you can work in a hospital, you can, there's just all sorts of different career options, basically to whatever you want to do. I mean, if, like Colleen, you really like people, you can, work in a healthcare field that deals with people a lot. Or if you don't like people as much, there are options for that too. So I think it's really cool that, working in healthcare, the options are essentially endless to where you see yourself and what you can find something that you're passionate about.
Definitely. I think that is very true. And Teresa, would you mind sharing?
I have to agree with Hilary on that. It is very broad. There's something in healthcare for everyone, regardless if you love to run numbers and collect data, to, if you enjoy making sure that we have a clean environment that is free of infection. There is something for everyone. So you don't just have to be a doctor or a nurse. You can be a parent who has had a lot of experiences. You could be that person that's sitting around the table and saying, we need to do this to make our family's experiences better. This is what the data is showing us. So there's lots of different things, but it's also, the biggest thing is, if you are a people person, it is very personable. It is, we really love our families. We love everyone that we work with. it's from the environmental services employees that go to clean a patient's room, can bring joy to a family's life, to the person who is checking you out in the cafeteria. So there is something for everyone, and it's a job that you will love. And that's the most important thing, is loving what you do.
That is very, very true. Thank you so much. So this next question that I have is specifically for Hilary, but if Colleen or Teresa, either of you guys have any additional things that you want to add in, you are more than welcome to as well. So this is a question that we got from a parent at Northmont High School. Her name is Heather, and she's a parent of an 8th and 10th grade students. And so she wanted to know how lifestyle choices lead to chronic medical conditions like obesity or heart disease and smoking. So she's more so asking for you all to talk a little bit more on the medical side of things.
Yeah, so I guess being a respiratory therapist, one of the biggest things for us is smoking. We see, I think people, you just think that smoking hurts your lungs, but it truly impacts your whole body. Is sure probably the most common thing we hear about is, lung cancer, which is, obviously a huge risk and very dangerous. And, there's other lung diseases like COPD, which may not be as well known, but it truly impacts your lifestyle and your ability to breathe. And, if you want to just get up and walk across a room, if your lungs aren't working properly, if you've caused a lot of damage to them, that becomes a huge workout for you. Like, it's not, maybe you can't go run a marathon. Maybe you can't get up and walk across a room, because that is how much damage you've done to your lungs to cause yourself, to have a really hard time just by choosing to smoke. Smoking also impacts, your skin and your teeth and, your breath and all sorts of things that, is a super negative impact on your life for something that, you may just want to do because it seems like a good idea at the time, which unfortunately tends to be, why people make choices like that. Obesity too, you wouldn't necessarily connect it to respiratory issues, but just having that extra body mass can make it harder to breathe. And if you're not getting up and moving as much as you should be, you are really just compounding the impact on your lungs. And I mean, most people don't think about breathing because it's something that's really easy that, we don't have to worry about. But for people with lung issues and other health problems, that could be the main thing they think about all day. So that's just something to keep in mind about how, the choices that you're making, how they affect your lungs, and what that impact is going to have in your life, not just for, being active and, doing whatever you want, but just being able to function in daily life.
And this is Teresa. I have something to add on to that. It's not just the physical health that it affects, it's also the mental health. And, it really wears when you have, especially a chronic illness, whether it be you're being obese or having asthma or having migraines, it affects your health physically and mentally. And there's already a lot of other things right now that is mentally draining and difficult to deal with. So that makes it even more important right now to take care of your physical health and to make sure that you're doing everything that you can to do self-care each and every day, even starting, in as early as preschool. We need to make sure that we're teaching our children to have self-care so they can make sure to be mentally okay.
Yeah, thank you guys both for sharing. I think it's sort of important for our listeners to realize that, you know, as people that work in the medical field, you guys both want to treat the illnesses that come to you and help the people that are sick, but you also want to help people so that they don't have to come to you in the first place and they don't need your services. So hopefully that leaves some good messages for our students here. And we only have 4 minutes left in our session. This time has flown by. So I think before we go, I just want to ask you all, if you were a middle school student that is, you know, sitting in their room right now, is thinking about healthcare professions, is interested in this field, sort of what is the like one lasting comment that you want to tell them or have them remember from our time today? And Colleen, I can go ahead and start with you.
Sure. I think I would just say kind of look at all your options because being a doctor or a nurse isn't the only career that is available in healthcare. And then just do well in high school and do things you enjoy. That'll help you get into a good program, whether it's community college or trade school or like four-year college. So I think that's kind of what I would focus on at that age.
I think that's a great plan. Thank you. And Hilary, would you mind sharing?
I guess I would say just stay curious and start finding out about the different things that are available to you, because the further along you get, you know, when you're trying to make decisions, if you start like looking now what all the options are available to you, even if they're options you're not that interested in, they may lead you to something you're interested in. Just, you know, keep your eyes open, look around, ask questions, try to give yourself as many options as possible to find what you truly want to do.
I hope that this helps people do that and encourages them to continue to do research on their own as well. And Teresa, certainly not least, but our last speaker for the moment.
The one thing that I would say is find what you're good at. Find what you're good at, see what options there are, and build around that. You know, and remember, not everybody's path is the same, and find a good mentor. Having a good mentor will take you a long way. Someone who's going to make you be a better you.
I definitely think that is great advice and a great closing statement for us. So before we let you all go, I just want to say thank you so much again for sitting down with us today. We know you all are very busy. And also thank you guys for the work that you do at Dayton Children's. From this talk and from what we've heard from you all, it is clear that you all are doing really important work, and we appreciate you guys coming to meet with us today. And for our students, I just want to say that we will be adding in a couple links to our YouTube chat here soon that will give you guys some information about some different things that are coming up, some ways for you guys to learn about financial literacy and other programs that we're having happen this week in Dayton and on the national level. So look for those in the YouTube chat, and we will start our next panel here in about 10 minutes.
Thank you all so much for joining us. As you hop off, we just wanted to say one last time, thank you so much. We know you're busy. We're glad you were able to join us. And if you're just logging on to YouTube or your class has just started, we want you to know that we'll be getting started and at 8:50 with our next round of panelists. We're all going to go ahead and mute ourselves. So you'll just see a stay tuned for our next guest slide, but we will start promptly at 8:50, and we can't wait to continue this great panel. So thank you, everyone. Dayton Children's has just done so much to bring careers right into your classroom. So thanks, Hilary. Thanks, Colleen. Thanks, Teresa. And Madison, you've done a great job so far. I'm glad that you're my co-host throughout this morning. So thanks, everyone. So welcome back to Health Professions Week. It is 8:50. We're waiting for a few of our panelists to get on. I see we have two of them here with us on the Dayton Children's camera. Who do we have with us right now? Oh, we have four people. They all just hopped onto the screen. If you guys are okay to go ahead and unmute yourself. This is our second panel during today's panel marathon. Who all do we have with us?
I'm Celeste Williams. I'm an inpatient clinical generalist pharmacist here at Dayton Children's.
I'm Breanne Hosier. I am a technician here at our inpatient pharmacy, and I cover all of our non-sterile compounding.
I'm Alyssa Black. I work in the laboratory. I'm a medical laboratory scientist.
I'm Emily Cromer, and I'm a X-ray technician.
Well, thank you so much for joining us. I know it's normally we'd have you out in front of a giant auditorium full of students talking to a whole group of kids. We hope that this is a little bit easier for you. No pressure. You are on YouTube Live. We've got some folks saying good morning. We have 5 different students saying good morning this morning. So a friendly bunch so far. My first question for you, and anybody can take a jump at it, is what is your position? I know you kind of just said what your position is, but what do you do in that position?
I'll start. I'm Celeste again. I am a inpatient clinical generalist. So I do pharmacist work as both an inpatient pharmacist where I check, verify doctor's orders, and then check what the technicians do when they make the orders. And then I also work up on the floors and round in the units with the doctors and families to discuss patient care. And I specifically focus on their medications and the best way to make sure that they're getting what they need when they need it. You want to go, Bree?
Hi, I'm Breanne Hosier. I am our tech three of non-sterile compounding. My day-to-day is we come in and we kind of just start with checking all of our kiddos' meds and making sure that all of their correct medications are where they need to be. We're going to see the orders and all the first doses come in from the doctors, and then the pharmacists are going to verify them, and we're going to go ahead and draw those up and make sure that those kiddos are getting the correct things. We also spend a lot of time, since we are in a children's hospital, compounding our medications because they're not generally commercially available.
I'm Alyssa. I work in the lab again. General days, there's several different sections in the lab, so everybody's a little bit different, but usually we come in and we have specimens that were collected from your doctors or like urgent cares, EDs, whether they're like swabs or blood. We come in and we have the orders and we start them up. Sometimes they go on analyzers, sometimes they go under microscopes. Sometimes we grow them to see if there's bacteria there. So we'll go through whatever your doctors ordered that day or the day before, and we turn out results, and that's kind of the gist of what lab does. Yeah.
I'm Emily Cromer, and I'm an X-ray technologist here at Dayton Children's. I work in medical imaging. There's me personally, I work in radiology, and I work in interventional radiology, meaning I'm in the cath lab quite a bit. We go to surgery, we take x-rays there. Any kids are sick on the floor, we take x-rays of them portably so they don't have to leave their room if they're too sick. We have plenty of outpatients that come in for imaging as well as the ER. And then of course, other people in our department are MRI, CAT scan technicians, ultrasound technicians. So those people also are seeing general like patients as outpatients as well as inpatients. So we're trying to see what's going on inside you to get you a diagnosis.
Well, perfect. That is very helpful. My next question for all of you is, how did you get into healthcare? I'd love to learn a little bit about your pathway. How did you figure out this was something that you were interested in? And just kind of let us know how you got to where you're at.
I'll start again. I started as my first degree was in deaf education, and I figured out that, well, that probably wasn't what I wanted to do with the rest of my life pretty quickly. They're very loud. So I went ahead and decided to go back to school. I was working at CVS as a store manager then, and looked around and said, well, what do these people do? And it looked interesting to me. I've always kind of been interested in medications. So it has a very heavy math and science background in it, which I love as well. And the requirement is that you learn every single day. There's more to learn. I will never stop learning in my profession because it changes every day. As we probably all learned with the current pandemic, everything changes. So that's how I got into it. I love it.
So I got into pharmacy right out of high school. I actually started as a technician the day after I graduated high school, just kind of as a summer job. And I figured out I really liked it. I really enjoy the math and the science aspect of it, which is why I choose to compound every day. It's kind of like the fun side of science class. You get to make things and see how they turn
out. My mom was a nurse growing up, and so we were always like, I was always around like healthcare stuff, but I knew I didn't quite want to be a nurse. And I really liked animals, so I started to kind of go towards like vet school, like vet techs, started towards my biology degree in college. And then I had a class with the advisor for the lab program there at Wright State. And we did case studies. It was like every week we just had kind of an unknown, like here's what's wrong with this patient and here are their lab values, their blood values, and how can we use this information to figure out what's wrong with the kid. And so to me, I really liked puzzles, and like that was kind of a fun, like figure it out. I was like, I can do that. And I really like working in the lab because obviously I use my hands. I like to work with my hands. Instead of just like a job that's all paperwork or working with people all the time. I like to be able to take a specimen and like to do something with it. Like to me, that's the most rewarding. And every day, like you were saying, like there's new things. Like healthcare is not like you learn it once and you're done. Everything changes every day. So I love that part.
I was a vet tech for 10 years, and where I lived, there wasn't enough money in it to make a living and to support my habit of horses. I have 3 horses and I needed to make more money. And so I decided I wanted to go back for something. So I had always wanted to be an orthopedic surgeon, but wasn't sure that that's really what I wanted to do at that point in my life, because at that point I already had a daughter and I just wasn't sure I wanted to do 12 years of education. So I went back and I decided to do x-ray and then CAT scan and MRI.
Well, that is fantastic. We have a question from David in our YouTube live chat asking, what is your favorite part of your job? Some of you kind of alluded to it in your last answer, but what's your favorite part of your job?
My absolute favorite part of my job is I get to serve people every single day, make sure that they're taken care of, make sure that they have what they need. And it's just absolutely the most rewarding thing for somebody to get better and go home. In the HEMONC unit, we have a bell to ring, and that sound is just the best sound you'll ever hear.
Obviously, my favorite part of the job is definitely making things, kind of little science experiments, but just the fact that it's feeling I'm a parent, and I just love the fact that what I'm doing with my little science projects are getting these kiddos what medications they need, because nobody wants to swallow a pill if they don't have to. Nobody wants to crush it and take it when it doesn't taste good. So just kind of making sure that those things are knowing and that those kids are not enjoying their medication, but at least it's a little bit better and they're going to get better and go home.
I specifically work in a part of the lab where we grow like bacteria. So if you have an infection, so we figure out what's causing your infection, and then we figure out what medications actually work against that specific bacteria. So like I love it when the doctors are coming down and they're like, hey, can you tell us, like, what do you see? Like, what's growing? Like, what? And that it kind of gives them an idea from going from a really generic drug to something that is really specific. So you don't have to give them as many medication. And you're able to kind of, I mean, it's an unknown. It's kind of a puzzle, like figure out what's going on and how you can best help the patient so they don't have to take as many medications and they can get better quickly. So it's really rewarding to be able to do that.
I don't sit still well, and I like to always be on the move. So I appreciate that the high volume and high pace that X-ray and CAT scan and medical imaging has to offer me, because I don't do slow, and I like to multitask. So I love that aspect of it. That it's never boring. You never see the same thing twice. It can be anything from a tumor to somebody, you know, breaking an arm. It just, you never know what's going to come through the door, and I like that aspect of it.
So we've had a few more questions in the chat. One question we have before Health Professions Week even started was from Sarah, who's an 11th grader at Miami Valley CTC. And she asked, how hard was college for you all? But then that kind of leads into another question we just received in the chat from a different David, asking, how much school did it take? So my question to you is, how much school did it take, and how hard was college for you all, if you went that route?
I had a prior degree, so I was lucky in that I had some of the background for pharmacy, but it takes 4 years of pharmacy school, no matter whether you start with a 2-year degree or a 4-year degree. So it's either 2+4 or 4+4. And then nowadays they're really pushing for people to have residencies as well, and you can do a 1-year or 2-year residency. Pharmacy is one of the hardest school programs that you can go into. And I will tell you, I absolutely readjusted my expectations from being a full-on A student to, yeah, I'm not anymore. So it was a very, very difficult schooling. Like I said, tons of math, tons of science. Chemistry is so important in my degree. I use it every single day. And it's really not an easy one to get into, but if you love math and science and you want to study, this is it.
So here at Dayton Children's, we do have a tech trainee program that if we have further questions on, Celeste actually teaches it. I myself, before I decided to get certified, I already worked in a retail pharmacy for 6 years. So at that point, I had enough hours and experience, I was able to just go take my exam and pass it and become certified.
So there are actually 2 different kind of ways, or 3, I guess, for to work in the lab. I got my 4-year bachelor's in biology first, because I didn't know that I wanted to work in the lab until like my junior year. In which case I got my 4-year degree, and then I went back and applied for a 12-month clinical period where we did, where we just had a concentrated classes geared towards what we do in the lab. And then we had like 6 months of like we actually went to different hospitals, and we I can't think of the word, but we did our rotations and stuff. We interned basically, sort of, where we got real in-lab experience. So you could get a regular, a related bachelor's degree first, or you can do a 4-year degree in medical laboratory science. But I know Sinclair is a local school, but a lot of like 2-year schools, they have a kind of an abbreviated program for it. So you can get an associate's degree and still work in the lab. Which is really nice for people that maybe don't have the time or the money to be able to do like a full 4-year degree. But then what's really neat too is then after you've been working for a year or two and as a 2-year degree person, you are able to kind of they use your experience, your work experience, and you're able to sit for the exam that the 4-year people would do. Which will allow you to kind of have the pay increase that would be associated with having a 4-year degree, which is kind of a really neat opportunity too.
I went to Kettering College of Medical Arts here in Kettering. Sinclair Community College also offers a degree in radiation on radiology. It's a 2-year program, but that includes, you have to take 1 year of prereqs, like just your general stuff, your Englishes, communications, religion, that kind of stuff. So to be an X-ray tech, that's an associate degree, but then you can add on to it and add like different modalities like CAT scan, MRI, nuclear medicine, and PET scan. So you can add on to those, and you can do that all. I don't think St. Clair has. No, I lied. St. Clair does currently have an MRI and a CT program. Kettering has that as well. And if you want to do something like mammography, if you go down to the University of Cincinnati, has a program down there if you want to add on there. In terms of the school being hard, it wasn't necessarily hard. You have to put in the work. But I maintained pretty close to 4.0 the whole way through. You had to study, but it wasn't terrible. You can do whatever you want to do in life if you apply yourself and work hard at it.
I did forget to mention that for pharmacy, it is a doctorate degree. It is required that you have a doctorate to be a pharmacist in the US everywhere now. The prior degrees, there are some people still working who had a Bachelor of Science that was a 5-year degree, but that's no longer allowed in the program. Sorry, just wanted to clear that up real quick.
Yeah, I know I didn't talk about the difficulty because it is also like 4 years of math and science and stuff. And it's a challenging program, but like all of the people that I was in with it, we all thought it was really worth it in the end.
So that's a great segue to one of my questions, which is from Amanda, who's an 8th grader at Kettering Middle School. And she wanted to learn, and you guys kind of just all described how hard it was to get to your goal. But what did it feel like once you accomplished it and started working in your roles?
Well, we walk around at graduation for pharmacy and say, congratulations, doctor. Congratulations, doctor. It felt amazing. Nobody calls us doctor after that, ever. Which is fine. I don't mind. We actually have a little argument in the pharmacy profession over whether we should be called doctor or if we remain more accessible to our patients by just being called by our first names. So I go with first name because I want you to know you can come to me with any question you ever have. And I absolutely love it. It is the most rewarding thing. All that hard work really paid off. And it paid off not just in my work itself. Pharmacy really pays pretty well. We make, the Bureau of Labor Statistics says that the average pay for a pharmacist is $125,000 a year. So it's not a low paying degree. Right out of school, people are making at least $110,000 a year in this area specifically, and much more in the more higher cost of living areas. So it's rewarding on a couple of different levels.
So for me, when I became certified, I still worked in a retail pharmacy, so like your Walgreens and your CVS. So it didn't seem as rewarding at that point. But once I got into hospital pharmacy and was able actually to use my certification, it's really rewarding to see those people go home. Anywhere else, you want people to stay on their meds and you want them to come into the pharmacy so that way you keep your job. But here we really just want everybody to go home and be healthy. So it's definitely, we don't make quite as much money as the pharmacists, but we definitely, it's definitely a good paying career, and it's rewarding and
tons of responsibility.
Yeah, it is.
Yeah, I know that once we finished our program, it was just kind of we're done. It was like, are we really done? Because we could, working in like the lab, like it's pretty easy to go off of that degree and then to go on to med school, or a lot of people will use it as sort of an interim, because you get so much valuable experience that will help you in other medical fields. But it also is a good paying job that's better than like an entry-level job for something else. So you get experience and money while you're also doing other stuff. But you also don't have to do any further schooling. You can get really far in your, in this field without ever needing to go back and to get your, master's and doctorate. And certainly you can if you want to. But it was just kind of nice knowing that, okay, I don't have to do school right now. So it was good. And I mean, and it pays well enough that I was able to like pay off student loans within like a year or two, like with, you know, takes dedication to do it too, but like, it was kind of nice. It's not a fast food career at all.
I had a daughter who was 5 when I went through the school for this, because I did a few other things, like I said, before I went to school for X-ray. So I had a daughter, and so I just remember being so relieved that it was over, and that, you know, I got my bachelor's degree in 2 years instead of 5. So I was taking like 24 credit hours a semester to push through, so I could be done quicker. And so I just remember being very relieved, and, you know, it is rewarding to be able to go, you know, and work in your profession. And there's an ebb and flow of, like, if there's too many, you know, people in your profession or not enough. And so right now we are seeing, you know, where people are very hireable and people are getting jobs right away out of school right now in this career. And that's nice. Currently, when you graduate, you can expect to make, start off at about 55,000, and depending on what modalities you end up with, the upper, you can make 86,000 currently is what you can expect to make. And I really feel like the work that I put in and whatnot, and the, you know, modalities I added, it's all been very much worth it. I wouldn't do anything else, I don't think.
That is all very helpful, and I'm sure the students listening in their classrooms or at home appreciate your candid answers. Nevaeh, an 8th grader at Kettering Middle School, wants to know what it's like to work directly with patients. I don't know if any of you work directly with patients. Can I get a nod of the head if you do?
Yeah, I do.
Okay, I see a wavy hand. So I think I'd love to hear, you know, what's it like to work directly with patients?
I don't directly with patients. I do a little bit of teaching on some things for the kids, but for the most part, I teach parents how to give medications here. When I worked in retail, I worked directly with patients every day. But now as an inpatient pharmacist, my main customers, as it were, are nurses and doctors, and then the patients and families.
I work directly with patients on every exam that I do. It's rewarding. You know, kids are funny, so they say funny things and they amuse you. And kids kind of have a different, like, approach to illness, where an adult's real sad and may take the news, you know, not as good as a kid who's, you know, they don't stay down very long. So they're funny, they're refreshing. I just really enjoy helping people, and I really enjoy making a difference, and being there, you know, for them when they might be experiencing the most stress that they've ever experienced.
That's great feedback. All right, so, you know, while it's Health Professions Week and we want to encourage students to consider going into health professions and bioscience careers, we also want to be real with them. We want to be honest with them. So we had one question in the YouTube chat. Do you dislike anything about your job? Was the training hard? So I'm sure you all will figure out a safe way of saying what you dislike, but I think it's, you know, it's all not easy. So, you know, highlighting what you dislike is really honest and helpful to the students watching at home.
So being a pharmacist is hard. I'm not going to lie. Some days it's so busy and you are so swamped with work that you don't know that you can finish it all. And some days you don't finish it all. You go home feeling like maybe I was not able to help every patient as best I would have liked to. I have been a clinical pharmacist in an ICU for adults. I did that for 12 years. And there were days I left and I said, I feel like I could have killed somebody. It was so busy. And then there's, you know, the days where you're just fed up with all of the things on your plate, and it feels like your plate is 6 inches wide and the work on it is 12 feet wide, and you just don't know if you can do it anymore. But then you come back and you say, you know what, I'm going to get to work, and you get it done.
I think, like, work standpoint, you come in every day and you know what to expect. It's the curveballs that kind of throw you off, the drugs that don't want to crush properly, or the kiddo who had a really hard night and all their medications got changed, and you just really feel like behind, and because your nurses are calling and you don't have those meds done for them yet. So now your kiddos are waiting, and your nurses are having to wait with the parents and things like that. So those are probably the hardest times that you get, is just the medication changes and just trying to make sure that their stuff's there on time and correctly.
So one of the things that I love about my job is that like each day kind of there is a set routine of things that need to be done. Like, well, this is what I'm going to be doing, and this is what I need to do. But every day, the things that you get to do are a little bit different. So there are definitely the days where like it's kind of your job to sort through problems that came in on like the shift before you or the day before you or as they come in, and you're like, well, none of this is ordered correctly, or these were labeled wrong, or you have different issues that come up, and sometimes one little thing will take, I've had a problem, I feel like take like 6 hours to, kind of on and off working with it, and it'll be so frustrating then, at the end of the day, and it was something little, but because there wasn't the communication or something, there's just always going to be days that are just frustrating. But like to then I have my team of people that I work with too. And so then, I'm frustrated with this, but I have somebody that I can talk with, and they're like, oh, I know, and so we sort of have that team camaraderie, of, okay, but it's going to be okay. Like, but it's done, and tomorrow's a new day, and we're just going to move on and breathe.
I think 99% of the time I love my job, but sometimes you see something on a radiograph or on a CT or an MRI where, they didn't know they had a brain tumor when they walked in 10 minutes ago. They didn't know that they had bone cancer before you took their knee x-ray. And so those things can get really real for people real quick. And that you just discovered something that's going to make their life harder in the immediate future, if not for a long time after. And so it's the grave illnesses and the things that you didn't expect to see that make it a little difficult and a little, and challenging emotionally at times.
So thank you for your candor there, because I think it's important for students to understand that it's all, sugar, plums, and lollipops. It has its challenges, but inversely, kind of going the opposite direction, that what do you love? What do you love about your job? What makes working in your industry, working in healthcare, special?
Every day it's different. It doesn't matter if it's a different med that just came out or a different use for that med. I just absolutely love that no matter what I do, it's changing. And whatever we said today, it could be completely different tomorrow. And it's the same for the patients. They looked terrible today, but they look way better tomorrow, or the reverse too, unfortunately happens as well. But we all bear down, we work together. There's a lot of team atmosphere in pharmacy because I can't do it without her and she can't do it without me. So we really try to work together well. And I love that team environment and that ability to just bear down and get it done.
So I think that she touched on the fact that pharmacy is different every single day. There's always going to be something around the corner that can either knock your socks off, or it's going to be the best news you've ever heard. We no longer have to make this medication because now it's commercially available. And that medication used to take you 2 hours to make. Or, okay, now we're going to start compounding this, or things of that nature. But I guess the biggest thing is the teamwork. Like Celeste said, you can't really do it without the other person, whether you're just doing the smallest thing or the largest thing or anything in between. So a lot of times is you really come to work for your coworkers, just getting that friendship and looking forward to seeing those people every day.
Yeah, and that's my glasses. And honestly, that kind of is a similar with me. Like I actually, as a student, came and did my rotations in the lab that I work in now, and I really liked the people that I worked with. I liked the work environment. Like I felt welcomed by everybody. There was no some places have some dissension and stuff, and everybody was just really helpful, and they liked having a student there. They liked teaching. They liked showing me what they had, and so I really wanted to come and work here when I graduated. And I love the group of people that I work with every day. We come in and, it's like, hey, I haven't seen you all weekend. Like, what's going on? And, so what happened over the weekend? Do we have any new interesting cases? And I feel like anytime somebody's off for like a day, we miss something. And so it's like, hey, what's going on? And it's the camaraderie. It's, and we love that we can, solve kind of these, we can help the patients together. That's our team. We're not the doctors and nurses, but we're kind of the behind the scenes team that's able to kind of, hand the doctors like, hey, this is what's going on. And we were able to accomplish that.
I love that it's just highly technical. It's fast paced. There's a high volume. You have to be able to safely multitask. You use interpersonal skills. You exert compassion to your patients. I just love all of it. It's just kind of a smorgasbord of where I'm supposed to be, I think. I like it. I love it. So it keeps you busy. You never know what's, it's never the same thing. What I'm doing this 15 minutes is not going to be what's coming in the next 15 minutes. So I love it.
So because sometimes students will be hopping in and out of this YouTube live panel, I'm going to ask you all to phrase your question in a specific way, just in case somebody missed what you actually do. So you can say like, as a pharmacy technician, but the question is, what do you wish you had known about your field or wish others knew about your field before you went into it?
As a pharmacist, I wish that people realize that I don't just slap a label on a bottle or slap a label on a box. It's way more than that. I have to figure out exactly what's happening. Is this medication going to interact with this other medication? Can they be given at the same time? Is this one going to cause a problem because the person's allergic to something specific in it? I wish people realize that there is a lot going on right in here as I'm slapping the label on that bottle.
As a pharmacy technician, there's just a couple things that I feel like everybody needs to know going into it is and that's pretty much every field, is you have to be able to learn every day. You need to be able to think on the fly, come in every day and set a plan. Know that your plan's probably going to change. But try to set a plan and just be as efficient as you can, multitask. Our biggest thing is to support our pharmacists so they can make those really big decisions, but we are behind the scenes making plenty of decisions and changes ourselves.
I think honestly, I would have loved to have known that this career existed before I was a junior in college personally. Like I kind of thought that like doctors and nurses were the only people in healthcare, which is obviously not true. But it just wasn't something that I really knew about, which is why I really like doing this kind of thing too. So sorry, as a lab tech, I work in the lab. I think though also like to know before, I know a lot of like TV shows and stuff, they have like the doctors and the doctors run all the tests and stuff and they just go and this is one of the many things that they do. And doctors do a lot of many amazing things, but to know that there's like, this is the lab and this is what we specialize in. Like, so, I mean, I've gone to school for a week to learn how to use this giant analyzer that's the size of, I don't know, like two ovens next to each other, something that's huge. And I have to learn how to take it apart and, something's wrong with it and to do all of these things. And we know, what are the normal levels for all of these, all the blood levels and stuff that you have. And there's just so much detail that's needed to know that that these are the people that you have people that this is what they specialize in. There are little departments that there are people that specialize in just looking at blood smears, to see if there's cancer there. Like there are people that just specialize in blood bank where they issue blood to people that need transfusions or whatnot. That there's so much specialized knowledge that works in the lab. That nobody ever sees. It's a closed door that just says lab and you put samples in and you get results out, but there's so much that happens behind closed doors that never really, is broadcasted.
As a radiologic technologist, I wish people realized that we didn't just hit a button. It cost me about $40,000 to learn to hit that button, and a lot of physics go into it. You know, I'm administering radiation, and so there is a science to it. There is thought that goes into it. I'm not just hitting a button. So I think if, you know, there's a misconception that that's all we do. Also, there's also a misconception. I feel like, you know, people thank a lot of other people in the hospitals, but remember that you didn't get a diagnosis without us. You know, we see almost every patient that comes through the ER or is on the floor as an inpatient. You know, we see them all because at some point somebody's had an X-ray, an MRI, a CT, nuke med scan, an ultrasound. Somebody's been in our department or we've been to them for something to help get them a diagnosis. So I feel like people don't understand exactly to what level we are behind the scenes.
So we have 5 minutes left in our second panel during our panel marathon with Dayton Children's Hospital. And we have a question from a Stacy, who's a parent of a 10th grader at Northmont. And the question is, and you probably sensed this was coming, how has your job changed since COVID-19?
Stacy girl. Our job has changed. Everything we do has changed. You know, we hand sanitized before, but we're, you know, crazy over the top now. We aren't doing as much. We don't do as much telemedicine in radiology as some people have been doing. But, you know, just we have to wear face masks, like shields. We're doing face-to-face contact. That's really makes you feel like you're yelling at your patients. It's really frustrating to us right now because you can't hear very well. So it's messing with our communication. So that part has changed. But we're adapting. I think that the medical field is very, you know, we've been given a challenge, and just like everybody else, you know, we've adapted and we are, you know, rise to the occasion of making this safe for not only us, but for our patients as well.
As a pharmacist, most of what's changed for us is the medications we're going to use. It's not what's reported on TV every day or coming out of somebody specific's mouth. We know that our medications have just changed, and we have to learn every day. There's a new study, there's a new group of information about this vaccine or that treatment for COVID. So right now, we're just learning on the fly every single day about something new that's happening with whatever drug that's out there to be treating people today. Tomorrow, it'll be different, though.
As a pharmacy technician, the biggest changes that we are seeing, other than the PP and things like that, we were already sterilizing and scrubbing in when we're making drugs, but we're seeing a lot of shortages on supplies. So I may make a compound in one way, and now all of a sudden that drug or that vehicle is not available. So I need to find another way to make it, send it out for testing to make sure that it's going to still be stable. So it's just a lot of changes on how and when we make drugs.
Yeah, since we don't, in the lab, since we don't have a lot of direct patient interaction, it's not so much the PPE usage that changes, but the volume of testing. You know, people have been out, you know, with other people less, so they've been getting less sick usually. And like all through the summer and the fall, like volumes have just gone up and down, and it's kind of very sporadic and random. Whereas our department that actually runs the COVID testing has been so crazy busy. Like it's just nonstop. They have analyzers that as soon as they're done with run, they have, you know, three more runs just waiting there to go on. And it's just kind of, you know, how do we help each other out? So all of our departments just kind of work together to take care of kind of this sudden, you know, change in circumstances.
Well, I can't begin to even thank you enough. We have a goal of getting more students in the Miami Valley and from the Greater Dayton area in general into healthcare careers. And students don't know what they don't know. So you joining us all for today's panel has been so awesome. We've loved hearing all of your individual perspectives. And we had some great questions from the students that were able to participate this morning, but many students will be watching this in the future, their teacher's going to assign it later to their class. So hello in the future. And we're so grateful for you all to tune in and watch this panel for Health Professions Week. And to all of our panelists in this last slot, thank you guys so much. I wish you all a safe and productive work week. And thanks again for giving us some of your time. We'll be joining you again at, let's make sure I don't get it wrong, 9:40. Madison will be taking the helm and moderating the next set of panelists. But again, thank you so much to Dayton Children's Hospital and our partners at the Greater Dayton Area Hospital Association for helping us put on this week. We're going to post some links in the chat for you to find out more ways you can get involved. There's even a health professions career fair, a virtual career fair that will be taking place later this week. So if you liked anything our panelists said, make sure to jump in and participate in that virtual career fair. And to all of you, have a wonderful rest of your day, and we'll be back in about 10 minutes. Thanks again.
Thank you.
Thanks, bye.
See you later.
All right, so looks like we are going to get started. First off, I'd like to thank you guys all for being here. And I'd like to thank all of our students and parents and educators and everybody that is currently watching on YouTube Live. So we're just gonna go ahead and jump right on in. If everybody wouldn't mind just introducing themselves and telling us what your position is.
My name is Stephanie Quincy. I am a surgery nurse at Dayton Children's.
Hi, my name is Mel Braceras, and I'm a PCA on the 3rd floor of Children's Hospital.
Hi, my name is Kranthi Kishore. I'm a biomedical technician. We provide support for medical equipment.
My name is Emily. I'm a physical therapist in our digital and area at Dayton Children's.
Oh no, Emily, I think you're lagging a little bit. I'm having slight issues hearing you. It might work if you go off and then come back on, or maybe just try again, but we can go ahead and ask everybody that's sitting in our one room a question, and Emily, I can try to give you a second to figure out what's going on there, and no problems. So just for our first question, you guys have told us what your positions are, but maybe for students that don't necessarily know a lot about your positions, can you guys explain sort of what you all do on a day-to-day basis, what your normal day looks like?
I can start. So my day usually starts with picking up a patient from the pre-op areas, which we call it, which is where patients are assessed with their vital signs, temperature, blood pressure, things like that. They go through their checklist to make sure that they are healthy and okay to come back for surgery. Once they're checked off and ready to go, I take them back to the OR, and the room is already set up for the procedure that we're doing. And I work with anesthesia, a scrub tech, which is a certified person that assists the surgeon. They hand off instruments to them during the case.
Just check them and help them with whatever they need, help the parents with whatever they need. I do other things. I help with their input and output, meaning what they had for dinner or whatever, and how much output they had. And I also help with discharging patients. And I also help with admissions. We set up rooms. For admissions. And when they're discharged, I also help with walking the patients out, and we strip the rooms. And I also work very closely with the nurses and help them with minor procedures, such as maybe holding the babies or patients with their IVs and NGs and just minor procedures. And that's some of it.
That's a lot.
So like I was saying, I was a biomed technician. Our department worked to evaluate, install, maintain, diagnose, repair, calibrate, and test medical equipment to make sure they work properly. So every day we start our day with, we come and go through every department and talk to the nursing to see if they have any equipment that's not working for them, or if they have any pieces that need to be repaired. They will pick that up and bring it down to our biomed shop, and we repair them and send them back. And also we have a list of equipment every month that needs to be tested to make sure they are working right. So we also perform the testing. If the test fails, we try to calibrate, repair, and do anything we need to do to make sure they work properly. During the day, we may receive some calls from surgery or any other departments for some assistance, like replacement cables or fixing some problems with the equipment. So we assist them with that issues too.
Great. Thank you all so much for sharing. Sounds like you all have really unique and varied jobs. So thank you guys for talking about those. And Emily, do you think that you've been able to get on now?
I think so. I apologize about that. I was on a Zoom call earlier and it was fine, but I think our internet might be a little slow out here right now. I am so sorry about that.
Not a problem. So I'm guessing you probably missed our first question, which you came on just in time. They just finished answering over there, so we can ask you now. So our question is just, what is your position and what do you do on a day-to-day basis?
Yeah, so my position is a physical therapist or a PT. I work mostly in our outpatient site. So little kids get in the car and their parents drive in to see me at one of our buildings. And I see patients every day and we work basically to make them stronger so that moving around is a little bit easier. I might give my patients stretches or strengthening exercises to help them meet their goals. And a lot of times their parents come to me with concerns that their babies aren't rolling over or crawling, maybe that they're having trouble going up and down the stairs or something like that. And we give them exercises to help make that easier. I also sometimes work in our inpatient side where physical therapy might come into a hospital room when someone's staying in the hospital, help them get out of bed, go to the restroom, and then make sure that they're ready to go home, that they're nice and strong to go home after they've stayed with us in the hospital.
Great. Well, thank you all so much for sort of explaining your positions. I think that sort of helps our students get a better idea of what you all will be talking about here for the rest of this panel. So we can go ahead and move on to our second question, which is, what do you wish that you had known about your field before going in, or what do you wish like other people knew? And we can start with our group of three, if you guys want to go first.
Repeat the question again, please. I'm sorry.
No problem. So our question is, what do you all wish you had known about your field before going into it? Or what do you wish other people knew about your field?
Okay. I would say that nursing is a true sacrifice. I feel like that's something that people should know before they get into nursing. I feel like your heart definitely has to be in the right place because you're caring for someone else's loved one. I know I treat every patient, every child as if they were my child. And sometimes the dedication to do that is, I think, greater than most jobs that most people do. A lot of long hours, sometimes extra hours, extra efforts. Sometimes we don't always have all the staffing that we need, but we make it happen and we work together and we care for these babies the best way we can.
Thank you for sharing. And we definitely want to take a minute to pause and just say thank you to all of you guys for the work that you are doing, especially during the pandemic. We know that this is not an easy time at all, and we really appreciate that you all are willing to take a little bit of time out of your day to come and talk to us.
You're welcome. Thank you.
Well, I've always enjoyed my job here, and I love playing with the kids. And when I first started this job, I didn't realize that I get to play with children and feed them. I thought it was all doing vitals, and but it's more. There's more to it. Like I said, I've enjoyed feeding the babies, and I've been, I get to play with the kids, and it's really a fun job.
That sounds like so much fun. A really great opportunity for students that like working with children for sure. And Ms.
So let's see what I wish I know. At my school, I had a co-op opportunity, so I kind of know from that what to expect. But honestly, I know very little about this profession before I get into it. If I really know at the time what I know now, I may be scared and I never come in. But it's fun actually. Once I start doing it, I have opportunity to learn and explore. So I'm happy that I made this choice and I'm here today. One thing I wish people should understand in my department or any people who is working in the hospital, it's not about us. It's a teamwork. It's about a child or a patient family in the end. So we have to do whatever it needs to be to help them out. That's everybody should know and understand.
Yeah, I'm sure you all weren't able to see our last group, but they also talked a lot about teamwork and how they all work together to get jobs done. So that fits in really well with what they were saying as well. And Emily, would you like to share with us as well?
Yeah, I think one of the things, I also did have some clinical experience and a clinical experience at Dayton Children's. So I kind of saw a little bit about what that would be like coming into work here for us. But one of the things that I really wasn't expecting was how much, kind of like someone had said earlier, how much fun it is. Really, a lot of little ones don't know why they're coming to physical therapy. It's a lot different than they would as an adult. So we get to play all day long. We have all sorts of, our toy cabinet is huge. We get to play with cars and dolls and all that kind of stuff, which is really fun. But it's an interesting switch, still keeping that mindset of healthcare and strengthening, but also combining that with play, which is great. And how much I get to work with my coworkers. We have occupational therapists and speech therapists that I work with every single day. And it's been really nice to have that team approach to tackle a bunch of the family's goals too, which has been great. One of the things that I don't know that most people know, and I really didn't know until I was looking into the field, is that now it's the education is quite a bit of education to become a physical therapist. That's something that I wasn't quite aware of until I started looking into it myself, but it's an extra 3 years on top of when you go to school. But honestly, if I were to do it again, I would do the same way every time because I really love my job and it really lets you really understand the human body and all of the muscles and that kind of stuff. So it's been great. But those are a couple things that I wasn't quite sure about until I got into it myself.
Thank you so much. And you sort of started answering my next question. We've had a lot of students both in our YouTube live chat and as well as in our surveys that we did beforehand. So ask about your different sort of educational pathways, like what educational pathway did you take and was it difficult? And sort of along those lines, if you all would speak to that. And Emily, I can let you go first since you were already started talking about it. You want to add anything?
Sure. Yeah. I am a physical therapist, and that means that I did my undergraduate degree at a university. And the great thing is that's a 4-year degree. You can do it really in anything you'd like. There's a lot of different opportunities there to kind of set you up for physical therapy school. And then at the end of that, you apply to PT school, which is an additional 3 years. And there's a number of schools in Ohio and across the country that you can go to physical therapy school for, but that's a smaller group. The class sizes are a lot smaller than at your undergraduate degree, and you really tackle all of the things that you need to know to be a physical therapist. So that's a 7-year program, but there's also another option that a lot of people do as well called the physical therapy assistant program, and that's a 2-year program out of high school that you can do, and then you can work with patients after just a couple of years too. So that's another avenue that a lot of people really enjoy.
Great. Well, thank you for sharing both of those with us. It's definitely good to know that there's sort of multiple pathways to get into sort of the same type of position. And now we will move on over to our group of 3 to ask the same question. And Stephanie, if you want to start first, I can begin.
I can. So I guess took a less traditional approach. I already have a family and children and had to go about becoming a nurse in a different way. So I originally was an STNA like 9 or 10 years ago. And then kind of worked my way up and went to school to become an LPN. I worked as an LPN for a couple years in a pediatric office. Loved it. That's where I really learned that I love to work with children. And went back to school after a couple years to Clark State, which is a community college, where I received an associate's degree to be an RN. Dayton Children's does accept associate degree nurses. But they, expect us to go back within 3 years to at least get a bachelor's degree. So from there, I've been here 3 years, and I just started my master's degree for family nurse practitioner. So that's kind of my educational journey as to becoming a nurse. But like Emily was saying about starting at a traditional college, most people do that. They start at a 4-year college, or sometimes they go to like Sinclair 2-year college to receive their nursing degree, and then they advance their education from there if they need to.
Thank you so much for sharing. I definitely think it's important to realize that not everybody's educational pathway, even within the same career, is going to look the same. There's a lot of different ways to do things. And so, Alyssa, I will let you go next.
Okay, so I'm a patient care assistant. I didn't always start as a patient care assistant. I went to college for 2 years, and then I decided to do a medical assistant. And so I graduated from Medical Assistant School of Hawaii. And I got married, and we moved around so much that I wasn't able to get a job because I was moving every 2 years. And so when I got here, I've been here for 20 years, and I decided to apply for this job as a patient care assistant. And it's been wonderful since, like I said, I enjoy playing with the kids. I get to meet new people. The staff on my floor are amazing. The doctors, everybody's amazing. So it's always been wonderful. I've been here 20 years, and I have no regrets. I've enjoyed it. So
that's so good to hear, especially for students that might want to stay in Dayton and think about going into the healthcare field here. And Ms. Kranthi, would you like to answer as well?
Yeah, before this field, I worked a couple tech jobs, which I was not happy about it. They are not healthcare related. I think the reason I didn't like those jobs because there is not much human factor of what I was doing. I like really involved with people. So then I was researching about a career which can fit my skill set and my personality, and I come to know about this biomedical tech jobs. So for this particular job, it takes an associate degree in biomedical electronic engineering. It's really a 2 years degree for a good pay and good career. It's not really that hard, but we can spend 2 years. I really like my job, and also once I started my job, I'm advancing myself in educationally. I just finished my undergrad, and I'm planning to do my grad too. That's because I love my job, so it gives me an opportunity to go furthermore.
Great, thank you so much. And yeah, knowing that you can, get a position with an associate's degree and then keep working on your education, you can always keep learning new things. I think that's one thing that a lot of our panelists have shared today, is that it's very important to keep learning throughout your position in healthcare. And I can move on. So we have a couple questions that students asked that are for a couple specific panelists. So one question that I have for Stephanie is from Andy, and he is a 9th grader at David H. Ponitz High School. And he wanted to know, he's interested in working as an RN, and he wanted to get your opinion on your thoughts on the job outlook for RNs. Do you think that we'll need more RNs in the future? What do you think there?
Absolutely. There is such a shortage in RNs everywhere in the country, probably in the world. I mean, you cannot go wrong with becoming an RN. There's always a need. There will always be jobs. There will be people that are probably trying to recruit you. I know I get recruitments in my mailbox and in my email. I don't even know how these people are getting my information, but it's a very sought out job. Career, I should say, not job. It is a career. And there's so many options. There's so many things you can do as a registered nurse. I mean, you can do direct patient care, you can do management, you can do administration. I mean, you can do insurance. I mean, the sky's the limit. It is a very diverse career. I think it's a smart move. Good question.
Thank you so much for sharing with us. And next, I will ask Emily a question. So this one is from Ty Zane, a 12th grader at Dunbar Early College High School. And he wanted to know what courses or majors you prefer a college student to take to become a physical therapist. Are there any majors that you think are better suited, or any courses that you thought were really important going into PT school?
Yeah, I think that's a great question. So like I said earlier, a lot of schools say you can get a degree in anything you'd like for your first 4-year degree, but there are prerequisites for physical therapy school. So you need to take certain classes to be to apply for PT school. And there are certain majors that you can take that overlap with those pretty well. So my degree was in something called health sciences, which kind of gave you an understanding of the healthcare system and had a lot of those classes as well. A lot of my classmates and coworkers had a degree in exercise science or exercise physiology, and you learn a lot about the body and what happens during exercise and how to get stronger. And that really, really set them up well for a job in healthcare and specifically in physical therapy too. I would say those are probably two of the main ones. Some people also got degrees in biology or something along those lines as well. Some of the biggest classes that I would say are the most important to become a physical therapist are exercise physiology is a very big one, and then also your anatomy and physiology courses. A lot of what we learn and what we use on a daily basis centers around anatomy and knowing the muscles and knowing how they work and how to get them stronger, or if someone's in pain, what muscle might be causing that, or how do we help target those. So I would say those are the big ones, but it is really nice. You can really, whatever your interests are in, you can really customize it to whatever you like. But that's a great question.
Great. Thank you so much for sharing with us. And I will ask, let's see, got my notes all set up correctly here. Kranthi, would you mind talking to us about the importance of learning about bioscience for students? Tasha, a parent of a 7th and 8th grade student from Trotwood, Madison, has asked this question.
So the bioscience, people will get confused when we say biomedical technician. We don't really study science. We study a little bit biology, math. We are more about like electrical, electronics, IT, a combination of everything. So we are more technical sides. I know name is kind of confusing because we work on the hospital medical equipment, but we don't really study bioscience. Sorry.
No, that's fine. Thank you for clarifying. I think it's useful to know that sometimes these things can get a little bit confusing and you have to know a lot of different things to go into these fields. So that is still useful information for all of our students to know. And next, I will pose this next question to our whole group here. And so this question is, to you, why do you really love your job or your job in healthcare? What is really special to you about this industry? And I can have our group of 3 start this time, if that's okay.
Yeah, that's fine. I can start. Trying to think what drew me to healthcare. I think I've always been drawn to healthcare. I don't really know what significant thing did it. It just, seeing family members sick and wanting to have them get better. Watching the show ER coming up, just being fascinated with the action that's happening there and just being fascinated with how they move and the remarkable things that they do to save people's lives. That I think was part of what drew me in. But, my own career just working here, just the love for the kids and their love for you is just, it's unbelievable. It's the best job ever. To care for someone, to allow someone to trust you enough to care for their babies, I think is why I love working here.
Okay, so I've always enjoyed working with children. When I started, I used to work with adults. And when I came to Ohio, I had 2 kids, and I told myself that it would be nice to work with children again. And so that's what I did. I worked for Children's Hospital. And like I said earlier, I've been here 20 years, and I have always enjoyed working with the people, the children, and the staff are amazing. So yeah, I love working with children more than, I hate to say it, but I like working with children.
When it comes to me, why I like my job because actually I love my job because it's exciting, challenging. It always provides learning opportunities, and it has a promising future. Because every day I come to work, I can work with different equipment. We have so many thousand pieces of equipment here, so we can work with different equipment, different problems. I can work with different people. So it's really exciting to come to work, but some days it gets challenging when we encounter some new problem which we never worked with before. So that is the time we talk to clinical staff to find what exactly they need. We do research and read to come up with a solution, and we can use our head and hands together, applying critical thinking and some common sense to present solutions. But in end of it looks scary, but end of this process, we have an opportunity to see how our efforts really making other people's day a better day. That gives me a job satisfaction. So on top of this, like I was saying, it has a very promising future because biomedical technicians are on demand due to the reduction in the workforce because they're approaching their retirement age, and increasing the hospitals and outpatient treatment areas, and influences of information technology in hospital medical equipment and techniques. So anybody who likes to work with technical side and wants to work with people, this is a great job to consider or explore.
Great. You all had such informative answers. Thank you all so much. And Emily, we can move on to you.
Yeah, so I think why I love physical therapy as a job in general is I was really interested in the body's ability to heal itself, essentially. So we work with what you've already got, and we work on strengthening and stretches to decrease pain and that kind of thing. And I was really drawn to the ability that our bodies are so strong and so amazing that we can really solve a lot of problems and issues on their own without a ton of other intervention, which is so interesting to me. And also that we can work in a lot of different settings. So physical therapists can work in schools, in the hospitals, in nursing homes with older people, in an outpatient setting with athletes, in a hospital with little kids like I do. So that was really attractive to me as well. And I think probably the biggest reason why I love my job and love coming to work every day are those big moments that families experience and that I get to be there for. So a lot of times we're there when babies are taking their first steps or learning how to crawl, or a child who has been working on walking for years is really, we give them a walker or some sort of assistive device, and they're walking across the gym. And so it's a very heartwarming and incredible moment. And you're there helping the family along. And you also get to know the families really well, because I have patients that I see once a week for a long time to work on these. So it's a really personal experience and really heartwarming and rewarding for sure.
Thank you all so much for answering that question. And, as we are all sitting here with masks on or in other spaces, you all probably expected to talk about COVID at least slightly. So we had a parent, Stacy. She's the parent of a 12th grade student at Northmont, and she asked, how has your job changed since COVID?
Oh, it's definitely been different. It's been an adjustment. In surgery, I wear a mask pretty much all day anyways. Before COVID, I was at least able to take it off when I wasn't in a patient's room. But I mean, just thinking back to the beginning of when all this kind of transpired back in March and April, not having enough PPE, having to reuse PPE, having to keep the same mask on, the evolution of the masking policies. It's just an adaptation that we all have to deal with, and definitely going through the process of having our patients feel more comfortable coming to our facility for care, making sure that they know that we are doing the utmost things as far as protecting them with masks and washing our hands and offering hand sanitizer in multiple places. I guess it's just been an adjustment, but I mean, I know we're all doing, I feel like, a great job of handling it.
Yeah, it has been a big adjustment for all of us. We're constantly having to put our masks and our PPEs on, our face shields on when we go into anytime we go in the patient's room and near them, and to do vitals, we have to have all those things on. It gets hot and uncomfortable at times, but we have to keep ourselves safe and also keep the patient safe.
I think for our department is the same as what Stephanie and they're telling. One thing that's different from our Biomed perspective is now we are sanitizing our equipment more often than before between every patient use. There's any additional stuff we are doing and kind of takes time, but we really follow our rules very strictly in Dayton Children's Hospital. So
Yeah, I think our department for physical therapy and rehab has also gone through a lot of the similar adjustments and changes. We are obviously wearing masks and goggles or face shields when we're working with little kids. And then probably the other biggest one is that we started virtual visits as well, which was new to our department. We had never done it before, and they rolled it out in just a week or two, which was very quick, but they kind of helped us along and gave us some training on how to do physical therapy over Zoom. And I still have a couple of patients that are doing that for reasons if they have a decreased immune system or something like that, where they still are staying at home, and I'll kind of instruct the parents on how to do some of the activities or exercises or stretches. And that's probably been the biggest change for me, is having to describe what I do to a family member to work with their child on their own. And it's honestly been a good learning experience for me as well, but definitely a big change for us.
Well, thank you all so much for talking about that. We know that this has put a lot of pressure on our healthcare workers. So we really do appreciate all of the work that you all are doing to keep us all safe. And we have 5 more minutes left. So I'm just going to ask one last quick question to wrap us up. And my question is just, if you were a middle schooler or a high schooler that was sitting here watching this call or is going to be watching it later, what's sort of like the one thing or one sentence you want them to remember about healthcare or your position from this time here? And I can have our group of 3 answer first, if that's okay.
The one sentence. I know it seems so simple, but I'm probably just overthinking it. I mean, just keep striving. Stick to your goals.
Mm-hmm. And don't be afraid.
Enjoy your job.
Mm-hmm.
I think that's all really great advice. And Emily, I will let you go as well.
Yeah, I would say if you're interested in a job in healthcare, it is a lot of work and a lot of education and stuff, but it's so rewarding. So I think looking in just with panels like these, looking into a bunch of different options and finding one that you're really, really passionate about is you can't go wrong. It's a great choice.
Yeah, thank you all so much. Your comments here have been really inspirational. I hope that they have given our students a little bit of a better understanding of all of the really amazing positions that there are in healthcare and there are right here in Dayton down the road. We thank you all so much for your time today. We know, again, that it's not easy right now to be taking time out to do these things, but we really appreciate it. And for all of our students that are watching, we do have some links in the YouTube chat that already were put there. So you guys can go ahead and look through that chat to get some links for some different websites, to get more information on Health Professions Week, and you're more able to do some research about some different health professions if you found anything here that you're interested in. And again, I would just like to say thank you for our panel. We will be signing off here for another 10 minutes, and we will start back up again at 10:30 with Breanne leading our panel. So thank you all again so much for being here.
Yeah, thank you so much.
Thank you. Bye.
Bye.
Welcome back to National Health Professions Week. My name is Brian Stewart, and I'm with the Montgomery County Educational Service Center. And this is just, I think, our final set of speakers in this morning's panel with various staff from Dayton Children's Hospital. Just want to make a big shout out and thank you to Deb Jacobs and Casey Hookfin and everybody at Dayton Children's who has participated today in this morning's incredible health career panel. And with me, I have a few new panelists. Can you guys all go ahead and introduce yourself with your name and what you do at Dayton Children's?
I'm Ftazia Leininger. I'm a senior medical social worker.
And my name is Becky. I'm a registered nurse in the ICU here, the intensive care unit.
Hey, and I'm Omer Kaplan. I work on digital consumer engagement.
Thank you so much. So you just told me your position, but now tell me a little bit about what you do in that role. Is there a typical day? Kind of describe what you do in your role.
So as a senior medical social worker, we do biopsychosocial assessments with families and children to kind of identify needs that they may have. So a big part of the job is identifying resources as far as like housing, transportation, food, and any areas that they're struggling in. We also work with children and families who may have experienced physical or sexual abuse. We kind of take those reports and information and work with police and child protective services. We also get to sit and kind of support children going through a serious medical illness. Maybe they had like a traumatic accident and they can't play sports for a while, or they're kind of experiencing some depression or anxiety. We just kind of get to offer that support. A typical day for a social worker can be a little crazy sometimes. It's kind of like if you have a question and it's not about a particular medical procedure, you call social work. So we can always get you an answer. If it's not something we do, we point you in the right direction. So I'm a generalist social worker, so I'm kind of all over the hospital, the emergency room, clinics, different floors. So it's quite exciting, and you just feel really good when you can kind of help a family through a difficult time.
So my job as a nurse in the ICU is there's really no typical day. It's basically my overall job is to take care of the patient. That's kind of like really the nurse's job on any unit is to be attentive to the patient and kind of coordinate their care for the day, talk to the doctors about the plan. So the doctors are kind of the ones who are ordering the plan, and we're the ones who are enacting it, is kind of how I like to think of it. But it's a team effort for sure. There's a lot of different disciplines. We often work with social work. We often work with dietitians and child life specialists and speech therapists and physical therapists and all kinds of people. But kind of as the nurse, you are like the point person for the patient. So a lot of times, it means giving them their medications. A lot of times it means coming up with a plan for them for the day to help them get to the next step. But in the ICU particularly, we kind of have the sickest patients in the hospital. So there's a lot of complicated thinking that goes on involved in like thinking about every part of their body and how we can get it towards the next step as far as getting them better. And sometimes they're really sick and it takes a long time. So every nurse that comes on for their shift is thinking about how they can move that forward for the next day, and just all in service of getting the patient better and getting them home. So yeah, there's a lot involved with that, and you never know what's going to happen. You never know what kind of patient is going to come in. You never know what the family situation is going to be like. But it makes it exciting, and it ends up being really fun and really rewarding.
Cool. So unlike my other awesome members of the panel, I don't work in a clinical setting. I'm more working on the technology/business side of healthcare. So my role is basically, so I'm fairly new to healthcare. I'm only 3 years in healthcare, and my role specifically is fairly new to healthcare. It's more wide known in the tech industry as a product manager. Essentially what I do is we have all these ways people interact with the hospital digitally. So from our website to our communication infrastructure to our mobile app to all of these different ways people interact with the hospital. my role is to essentially take each one and then understand how people use it and how do we kind of like build on top of it to take it to the next level to achieve our organizational goals and support the clinical teams. Because essentially my, you know, from a high level division standpoint, my role is to, you know, kind of like support the clinical teams to then, you know, help children and their parents feel better, right? So my typical day starts with coffee, I want to say, and then, so you got my coffee right here. And then usually it's, you know, looking at data, see how people experiences our different products, and then prioritize and decide how we're using our technology resources to, you know, implement the most impactful solutions for our patients and their parents.
That is all very helpful context to what you all do. It sounds like you have a very unique job, Omer. My question next is, how did you get into healthcare? What did your education pathway look like? If you did go to college, let us know what colleges you went to and just how you ended up getting into healthcare.
So I went to Wright State University. I started out not so much as knowing I would go into healthcare. I kind of went the psychology route and ended up realizing that all of the jobs I really loved were social work related. And so I went back and got my master's for social work again at Wright State. I myself have a few medical disorders. And so I just always knew like having that support, how difficult it could be as a child. And I actually grew up coming to Dayton Children. So it was really exciting to know that I could work here and be a part of that. So you can start out in social work in so many different areas. It doesn't have to just be healthcare, and it kind of prepares you to be able to work with families on different levels. So that's kind of how I got here. It's not the traditional path, but I love it here.
For me, I kind of just stumbled into nursing because it seemed like a cool thing to do when I was in high school. And so I was like, yeah, I like medical stuff. That sounds awesome. And honestly, I had no idea what I was getting myself into, but I love it. And it's the perfect thing for me. But I ended up, I went to Cedarville University and did their bachelor's program there. For nursing, you can also get an associate's degree and practice as a registered nurse. So there's a lot of people that go that route, start working as a nurse and then get a bachelor's degree from there. So there's a lot of ways you can go about it. I actually also have my master's degree in nursing education, so I really enjoy teaching as well. But I've worked at Dayton Children's ever since I graduated. We have an externship program here, which is like when you're a junior in your bachelor's degree, you can come here and work for a summer, and that kind of often leads to a job. So there's a lot of really cool educational tools we do here at Dayton Children's to help people along in their career. I've always felt really supported in my career here. And I knew I wanted to work with kids when I was in school. So I have always loved working here and, you know, have no plans to leave. It's really great. So yeah.
So from an education standpoint, I have a bachelor's and master's in communications. However, product management, especially, and I came from tech. So I think product management in tech is a kind of like a role people get from all different directions too. So some people would go through more of like a computer science background. Some people would come from marketing. Specifically, I've been in product for like almost 14 years. So I just started working at startup companies and started like building the role as I went through the industry. I was working, so I'm in Dayton for like about 4 to 5 years. I was working for a big video communication company prior, and then it got acquired by an investment group in Ohio. And then, you know, I was reaching out to the hospital and we started talking about how does technology and product management fit into healthcare. And I was like, oh my God, it's like, this place is so awesome. Like helping, like, you know, video communications is great and all, like we're doing the thing right now, but working like with children and their parents and alleviating a very stressful experience, which is healthcare, is super amazing. So that's kind of like how I got into it. So, I mean, my background in this communication is definitely helpful. It's not mandatory to get into the role at all. There's like many different pathways.
Awesome. So Ftazia, I'm not gonna lie, there's a lot of questions from students for you. So the first question is, what are the health professions that revolve around dealing with mental health issues, and what kind of healthcare careers are there that get to deal with mental health challenges in our culture, in our community?
So there's actually a lot. So if you go into social work, you can expect that there's probably 20 to 30 different areas or more that you can work in. So you have their typical therapy. You can be a therapist with a social work degree, obviously working directly with mental health. You can be a behavioral health tech, or you can work in an inpatient center with kids who are placed inpatient who are dealing with mental health disorders. We actually do a little mental health as well. We have behavioral crisis center workers. So if kids come in for an emergency crisis, they kind of do assessments. We kind of get to sit with kids and talk about their mental health and develop coping skills. They may be experiencing bullying, things like that. There's so many different things. We have a list of social workers who work in all of the clinics who can talk to kids about mental health with their disorders. So whether that be like neurology, if they're in the ICU, diabetes clinic, pulmonary, every area of the hospital has a social worker that works directly with those children. And many of them experience some type of mental health symptoms when dealing with a long-term illness.
So Graciola, a 7th grader at Stivers, asked about that, and Nevaeh, a 10th grader at Belmont. So they both were curious about the different areas. And now I'm going to kind of jump over to Becky, because Javier, an 11th grader at Dunbar, wanted to know, what advice do you have for students that want to become a nurse?
Wow, yeah. It's, you know, I will say nursing is, I can't imagine doing anything else. There are like so many aspects of nursing that I love, but my favorite, I think, is the fact that it's very patient-centered. There's a lot of things you could do in healthcare, and a lot of things that have to do, everything is centered around the patient. But as the nurse, you are the one who is with the patient all day. You are their main advocate, and you work with so many other, like I said, so many other disciplines to care for them. But I really love being the person who's in the room, who really knows what's going on, who is really able to kind of get the pulse on whatever the situation is and help bring in whatever other disciplines are necessary to take care of that patient well. There are a lot of like really cool things about nursing as far as just like the everyday stuff. Like we get to do help with all kinds of cool procedures. We get to do all kinds of cool stuff. And I think that's like what I thought of when I was, you know, your guys' age, thinking about what I was going to do. I was like, oh, I want to start IVs on people, and I want to like, you know, do all kinds of cool stuff. And, you know, when working with kids, that's actually, and it ends up being the kind of stuff that's hard, because it's scary for kids sometimes, and it's oftentimes painful. And what I've really loved about actually being a nurse is being able to help alleviate some of that and sort of get to know what helps children get through medical crises. And just like Ftazia said, like people, it's hard for kids sometimes to have to go through medical issues. Like it ends up being psychologically harmful. It ends up being just scary. And so when you're the nurse, you're the person who gets to be there and help them deal with that. There's also a lot of really cool critical thinking involved. Like I think a lot of times people think, you know, I always joke that like, you know, why are there no nurses on Grey's Anatomy? We're the ones who are actually like doing stuff, you know? So that's a little soapbox I like to get on, because I think it's the perception of nurses is that we're just like putting the bedpan under you, you know, and what's really going on is we're coordinating all of your care. We are the ones who are letting the doctor know when something is wrong. We're the ones who are at your bedside, assessing you and determining when something needs to be done. And the doctors are incredibly important. They obviously like are so smart, and they come up with the plan of care, and they take care of you as well, but in a different way. They're the ones who are thinking through the problem when you present it to them as the nurse. And so I think like it's kind of fun to be, there's a lot of aspects to it. There's like gross stuff we got to do every day. There's like cool stuff we get to do every day. There's dealing with people and like emotions and all kinds of stuff like that. There's just so many aspects to it. But I think it's something I take a lot of pride in, and every nurse I know does. Like it's just a very special thing to be a part of somebody's life when they're in a really difficult moment. And I think that's something that you learn how to deal with over time. But yeah, there's really nothing like it. I think like you're walking in somebody's room when they've just had the worst day of their life, and you're the person that they are turning to. So that's what I really love about it.
Awesome. Omer, you're going to answer this question first, but then it's going to go to Ftazia and Becky. So the question is, and this is from Alyssa, who's a 12th grader at Stebbins High School. And, this is a question that we can ask anybody in any career, but because it's Health Professions Week, we're going to do it through the lens of you all, which is, how do you recover from the tough parts of having a career in healthcare? Alyssa said that she knows that there are good and bad things, but she was curious about how do you recover from the tough stuff that you see and that you work through? And Omer, you get to go through that first.
So it's gonna be an interesting answer because my tough parts are inherently different than people who actually boots on the ground working with patients. I think in my role, it's involved a lot of like empathy and understanding like people's problems as they go through the process of getting into healthcare, getting outside of healthcare. There's a lot of variables that goes in outside of the clinical settings. Like for example, people get their bill and then, maybe they, struggling financially, or they have transportation issues, or they have, so how do you use some, for me, it's all about how to use technology in a kind of like meaningful way to alleviate those people's needs. And, I'm like, my exposure to the hard part gets, when we actually getting feedback, right? So people are going through the entire, let's say, care funnel or care continuum, and then they said, well, I had a terrible experience because 1, 2, 3, and 4. And, as a person who's, responsible for taking them through that, often using, digital means, it really, you say, oh my God, like, the things I do impact those type of people. I think the way to recover is essentially, first of all, kind of like understanding, really getting a good grasp on, problem that impact a lot of people, and see, what we can do, to kind of like take the problem, frame it, and solve it for the bigger cohort of people, if that makes sense.
So I would have to say I am a big advocate of self-care. You can never self-care too much. So I actually have a set date, which is typically Sunday, where I just do anything that I enjoy, whether that be stay in bed all day watching TV or spending time with family. Just anything that really truly makes me happy. The reality is you will have hard days. You will deal with the loss of a child, maybe a child who was severely abused or neglected, but just you have to soak in those rewarding times when you are able to help a family. One I can remember is I had a family whose home had burned down and they lost everything. So when we were able to actually help them restore some of those resources, and the mom just kind of cried and she was like so thankful. You really have to just soak in those good times when you do have those rewards of helping someone. But I would definitely say you use your teammates, you talk to them, you kind of process through, just kind of get your feelings out. It's okay if you need to cry some days because you are seeing some difficult things, but ultimately you have to self-care. So you have to take some time out to just care for yourself when you're not at work.
Yeah, definitely agree with that. This is a really, really good question because I think, especially in the role I'm in now, I used to work on a different floor that wasn't the intensive care unit, and we saw some really hard things on that floor too. But I've seen just in the last year since I've worked in the ICU, just some next level hard things where you're right there when someone's child is dying. You're right there when they are going through, like I said, maybe the most difficult moment of their lives. And I think something I've learned is that it's important to, like Ftazia said, take care of yourself. But it's weird how you can kind of do your job in the moment. And I think it's important after you've done that to go home or go in your car or, spend time with a coworker or friend and process that. I think sometimes we don't let ourselves do that. And I think that can be really harmful. It makes you become jaded. And I've always, since I've worked in the ICU, I've said, now seeing a few patients die and people that I have, cared for, it's really difficult. And I think I never want to let myself not cry for those kids or not just make it seem like just another patient, because they never are. They're always somebody's child, it's always so difficult and so sad, and it's a human life and it's always valuable. And so I think for us to just brush it off like that's just our job is a disservice to those kids. So for me, my faith plays a huge role in it. Just like Ftazia said, taking time to just do something that is helpful in the healing process for you, or just taking a day. I know a nurse who's been an ICU nurse a long time that says she always gives the following day to that kid. She'll just take the day and just kind of give it in honor of that kid, whatever that means for her. So I think those are really good ways to cope with it. And I think just kind of accepting that it's never going to be easy and saying that that's okay. But sort of like, I think what I find cool about it is that someone has to take that burden on. Someone has to care for that kid. Someone has to give, and you know, in children's medical world, we do everything we can to save every patient because kids oftentimes are more resilient, and we never want to give up on a kid. And so once you've given your heart and soul to care for somebody and they don't make it, it can be really devastating. So I think it's important to grieve that as a healthcare professional and to do what you can to help the family grieve. And sometimes they'll be really grateful for you. And those are, like Ftazia said, it's great. It's really good to soak in those moments because that doesn't always happen. And when it doesn't happen, I think you also have to know that what you did was worth doing, even if no one seems grateful. You know, it's not even always about that. It's really, really nice and great when that does happen. But it is also like, even if no one seems to care how hard you work to save that kid's life, it still was worth it. And so, yeah, that's kind of how I process it and deal with it. And I'm still learning how to do that because I've only been working in the ICU for a year, but it can be really difficult. So, yeah, I found it to be super rewarding, though, to be in the position of being the one to take that burden on for somebody.
Sure. That's heavy, but it's important for students to learn about the roles and responsibilities of these various careers. My next question is for all three of you, but it is about, it's actually been one of my favorite questions throughout the entire marathon of panelists, which is, you know, what is something that you wish you had known about your field before you went into it, and something like that you wish others knew about your career field?
That's interesting. This as social work, like you deal with so much. I guess I wish someone may have told me maybe about some of the hard stuff I would experience, because I didn't start out as a medical social worker. I kind of started in foster care and doing therapy and things. So I was kind of always used to just having to take on some of the energy from people of the things they were dealing with. But I can just remember like the very first time a child passed away, and maybe if someone just kind of would have made that clear, like you kind of know, like people do die in hospitals, but it doesn't really hit you until it hits you. And so maybe someone just kind of saying like, these are the tough things you'll experience. But I think Dayton Children's does a good job of helping you just kind of work with your coworkers and kind of, you know, sit back and process those things. They do support you that way. And maybe just kind of telling you maybe like some people will be difficult. It's, to me, I kind of enjoy that part, because when people are like upset and then they're yelling, or I've always done a good job at just kind of calming them down and helping them. But I think for some social workers, that could be a shocker, that people won't always see you as like this person who's coming to help. Sometimes they may have a negative outlook. And so you have to be prepared to not be upset by that. You know, everyone's experience is different. So.
Yeah, that's actually, I would totally agree with what Ftazia just says, that a lot of what shocked me when I went into nursing is that people often, you know, you come in and you think you're like the hero on the white horse and you're going to like save everyone, and they don't always see you that way. They think sometimes that you are out to get them, or that they, you know, it's just because they're in a stressful situation a lot of the times, and any of us would feel that way. But I think it's really important to be able to put yourself in a family's shoes and kind of try to see it from their perspective, because I think a lot of times I've been like, why are you upset with me? I'm trying to help you, you know? And like, I can, when I sit and think about where they're coming from, I can understand why they would feel that way about me, you know? And I think I just have to put my pride aside a lot of the time and say like, you know what? And whether or not they see me as a hero, I'm going to be here to help them and try to see what I can do to help, what they really need from me. You know, maybe what they really need is not what I want to give them, you know? So, I think that, and for nurses in particular, I wish somebody would have told me that there's like a lot of things that are not that glorious and glamorous about nursing. Like, gosh, they just don't show you that stuff on TV. I'll tell you what, it's like, there is a lot of gross things you got to deal with. There's a lot of just like sucking it up and doing it. Like it's, you know, it's not always glamorous, that's for sure. In fact, I'd say most of the time it's probably not. And there's definitely moments where you're like, wow, I just did that, and that's great. Or like, wow, that was really cool. I wish somebody could have seen that. And I think that's the other thing is like, when I go home and, you know, I talk to my family and friends, and you can't, you know, we have there's laws, we can't just share things about what happened at work all the time because we have to protect people's privacy. And so I think there's times when I want to go home and be like, guess what happened today? And like, you can share some things, but like there's also limits to that. And I think no matter what I tell my friends and family, they are not going to understand what I went through, you know, or what. So it's weird having my profession be such a huge part of me and such a huge part of the person that I've grown to be, and how it's kind of hard to describe that to people who don't see me do it every day. And so again, I have to lay aside my pride in that sense and be like, you know what, it doesn't really matter if anyone knows. I know that that's helped me to grow into a better person. And it also helps me have really good relationships with my coworkers, because I think in any healthcare profession, but especially in nursing, the other nurses who are there with you doing it are going to become your close friends. They're going to be the people who really understand what you go through on a daily basis. And so I think that's very important for sure.
So first of all, before I give my answer, like those people, I don't know where they're located, like in the video, but you know, you guys, like other panelists from like children's, you're doing like such an amazing work. Like, you know, just sitting in this panel, I was like, oh my God, you like, what you do is like so beyond me. That's amazing. Who I am, just messing around with code, you know, solving like business problems. You guys like amazing. Anyway, so my only thing that I didn't know before coming into this role, and I wish I'd known sooner, is that I wish I discovered healthcare as an industry sooner. Because here's the thing, like I was working in like entertainment and video communication. I worked in social networks. I have product friends on Netflix and Riot Games and Google, like all the big places. Like the impact, you know, even at the local scale, the impact you get to have on people's life, even sitting in, you know, in like the technology and like business unit and enabling those awesome people doing this amazing role with patients. I think like, I really wish I discovered healthcare as an industry sooner and like be just a part of that, like I am now. So I'm super grateful. But I would say if you consider, like if you're good with technology and you want to have an impact, look at healthcare as an industry. I think there's a whole world of amazing things like good technology, you know, workforce can do here. So, you know, if you're into that, it's pretty cool.
Great points. I love the various roles that everyone on this panel has right now. It's nice. It gives us a couple different angles. I'm going to be honest, guys. We had a lot of questions asking us about the stigma of mental health and seeking mental health care. And Ftazia, I would love to hear about how students can learn more about mental health and what their role is in breaking down the stigma about seeking guidance around mental health.
So there's definitely a stigma around mental health, and there's a lot of initiatives right here in Dayton that they can join, various like walks and clubs and things that actually work towards decreasing that stigma. I believe NAMI and a few other things. I probably could look into that a little more and email some answers, but so there's a lot of initiatives you can get in, but to kind of help break that stigma, I mean, probably if you're in middle school or high school, just kind of supporting your friends when they are feeling down, or maybe they're expressing some depression or just kind of anxiety or things, just kind of being there for them and making them feel like it is okay. It is very normal to feel those things, and just encouraging them to seek out help. Just as you get older, I'd say like no matter what you go to college for, just always kind of take some of those classes that are about mental health or psychology or sociology, just to get a better understanding of how people think, how they behave. Because when you're talking to people, everybody's different. So you have to you have to meet them where they are. You have to just kind of understand where they're coming from to talk to them. And so we do deal with a lot of families who may be experiencing some mental health, but they don't believe in therapy, or they're afraid to go. They don't think it'll work, or they're scared, like my friends are going to think I'm crazy or something. So you kind of just have to help them understand that all of these feelings are normal. We're human beings. They're completely normal. And there are just some resources out there that can help you. And obviously just letting them know, no one's going to know you're in therapy. Like she was saying, like we have those laws where we can't just say, hey, this person, I met this person and they're in mental health, you know? So just kind of knowing that it's always a private thing, but it's never wrong to get some help for yourself. And maybe going to a group with that person or, you know, taking them to that place and just being supportive. So.
Great guidance, great guidance. Becky, we have an 11th grader at Belmont, Jada, who wants to know kind of the cheat code, really, what colleges to go to if you want to become a nurse. How do you apply to college if you want to go and become a nurse? Like, what should they consider and think about?
Oh, yeah. Good question. Well, actually, we have a lot of really great schools in the area for nursing. Wright State is fantastic. Cedarville, where I went, is awesome. Sinclair has a really good nursing program. We have a lot of students and nurses here that have gone to Sinclair. There's honestly so many options in the area, and you know, even if you branch out a little bit, you could find so many great nursing programs. Kettering has a nursing program. So yeah, I think it just depends on whether you want to go the associate degree route or the bachelor's degree route initially. So that's kind of like up to you. I would say if you're thinking about applying to nursing, it's a really good idea to get some experience as maybe like a nurse's aide. If you're, especially like if maybe while you're in school or like if you're graduating soon, it's good to think about that kind of thing. I wish I did that actually, but not for very long. And I wish I would have gotten more experience ahead of time for a couple of reasons. One, it gives you a really good idea of what it's actually like to be a nurse when you're an aide. You get to see that up close and personal. And it will help you decide if you're not sure, like that's the route you want to go. Because like I said, it's not for the faint of heart. It's something that is not always glamorous, and it's incredibly rewarding, but I think it's a good idea to get a true picture of what that's like ahead of time. And for the other reason is, if you do end up becoming a nurse, you will appreciate the people that help you as aides forever, and you will not take them for granted, and you will understand how hard their job is. So anyway, as far as applying, I think if you look up, kind of get on Google and see like reviews for different schools, and depending on what your financial situation is, there's a lot of options and a lot of ways to be helped with that. And so I think get on there and see what other people say about those schools in the area if you want to stay local, and put in an application. And I think it can be academically challenging, but it's doable. And I think what I love about nursing as a science is that it's something that is it's scientific. Like it's not like up in the clouds trying to understand this like theoretical stuff. It's very like concrete. And so I think if that's kind of the way your brain works, that's the way mine works, and that's what I've always loved about it. So I think nursing might be the profession for you if that's how you function. So yeah, that's what I would say about that.
Great response, great response. So several people on this panel are wearing masks right now, and that's because we're in truly historic times, right? So the next question is, how has COVID-19 impacted your work? We just love to learn about how it's impacting your work, and I'm gonna pick Omer to go first.
Yeah, so it has been crazy, and again, you're gonna get like two different answers. So it's gonna be great. So I think at the beginning of when this whole thing started back in March, I think we had to really change the way we think about, taking it out of the clinical setting. How do we like deliver software in times of a crisis? Right? Because we started like really strong, real like cut and dry. So we really changed the whole way of how do we think, like how do we identify problems? How do we identify, who are the people we are caring for right now? What do they need right now? And build software for them and in a timely manner. So we actually shifted how our development team is structured, how our software delivery has been like structured. So at the beginning, it was a lot of like rapid changing, working, full time, lots of hours about, what do we need right now? How do we make it happen? How do we measure things that will help us, kind of like as this thing went through. I think right now, the interesting thing that happened is that as we get more market data on how COVID impacts like different facets of healthcare, there's a lot of like new problems emerging, right? So if you take, for example, the issue of healthcare safety, it looked very different before COVID and it's very different after, to a point where some people say, oh, I'm not gonna get my kid to the hospital because it may not be safe. So that's a new problem we're dissecting. We're looking at, okay, well, who are these people in the perception of safety? What are the challenges and where does those challenges present themselves on the kind of like care flow? and how do we potentially, use technology to solve them, like things like touchless registration or registration through your mobile and getting, like, I don't know, test results through a mobile application, right? So a lot of new problems. I think the mindset of consumers is changing. I think, financial circumstances are going to be challenging. So for me, it's all about different cohorts, different problems, and then it's all a matter of finding those problems and see how we can use the resources we have to solve them from a business perspective. Now to the clinical answers.
So for social work, it just different types of problems emerge. So with COVID, you have the restrictions on visitation. So a lot of what we had to address in the beginning is just some of those families accepting that and struggling with that because they're used to being able to have like aunts and uncles and just anybody come and visit. And now we're just kind of down to caregivers only. And that can kind of be tough, whether that just be mom and dad, but then you have grandma wants to visit. And so sometimes there's just a lot of conflict when it comes to that. Just working with the families, maybe making exceptions depending on if it's like end of life kind of care. It kind of got a little slower. And I just wanted to make sure people know, like when you're in healthcare, there isn't like days off. You know what I mean? Like you don't just get all these random days off. I know some people were able to work from home. There's no such thing. So when you're in healthcare, you have to be in the building, working with the families and stuff. So that was good. I mean, job security. So that's really good. But just kind of adjusting to the new problems that people have. Like Omer was saying, there's this stigma like, oh my God, the hospital's not safe. And so we didn't have as many people coming in. But once things kind of calmed down and clinics opened back up, there was this rush of patients. And so you have this rush of social work consults coming in and lots of new problems. And unfortunately, when kids are not in school and not around certain people, a lot of abuse goes unnoticed. So those abuse cases start to rise as kids start returning to school and back to normal activities. So.
Yeah, I would say definitely from the nursing perspective, visitor restrictions has been a huge thing just to deal with regarding COVID. From a similar perspective of just like, it's really hard for people to not be able to come visit their kids or their, their grandchildren or their nieces and nephews when they're in the hospital. It's hard for parents who don't have that support. We initially actually were only allowing one visitor, and that, we had dads who were having to go sleep in the car because the mom was staying with the patient. And that's just really hard for the kid. It's really hard for the families. And so while we all understood why we were doing that, and everybody, was really understanding because we were just trying to keep people safe, but it was hard. So it's nice now that we can have two visitors, but still there's a lot to deal with there. For us who are working on the floor as nurses, it's also like, it means every room I go into now, we're wearing a mask and our face shield, and we are doing everything we can to protect ourselves and the patient. We don't want to spread, and a lot of times it's not just to protect ourselves, but we don't want to spread things from patient to patient because, if you go in one room and you go into another room, you have to be really aware of that. As nurses, we're really used to doing good hand washing. We're used to wearing gowns, masks, gloves, all this stuff to protect ourselves from other viruses and things. So that's not really new. It's more just like the heightened awareness of how quickly this virus can spread. And, we want to do our part to protect people. And again, yeah, there's, people were initially scared to come to the hospital. And so now that we have more people coming in, we have to continue to stay vigilant to try to not spread it around. And, there's also times when we have patients that are positive for COVID. And so we kind of, there's sort of like just a part of you that has to just kind of do your job, even though it's a little scary and you don't know what could happen, but it makes us even more responsible to wear our, protective equipment and wash our hands well, and just for the safety of everybody around us and for ourselves. And so I think practically that's kind of how it's most impacted us.
Well, we're nearing the end of this panel, and I'm going to give you all each under 30 seconds for some final parting words for the students that might watch this today and might have watched it live, might watch it in the future, but are really considering careers in healthcare, and any parting words you have for them.
So I would just say Go to school for social work. That is, I obviously didn't initially start out in social work, but I have discovered that it is one of the greatest careers of all time. There's so many different positions in the hospital you can work with. So many different clinics. You can work in emergency room, just any floor. I also work in the NICU, so I get to work with infants too. So I would just say it's something great to go to school for if you just have this basic principle of I want to help people. There's so many different jobs you can do helping people, but in healthcare, it's really exciting. So I know that we've talked about some tough things that you go through, but it is very rewarding and very exciting.
Yeah, I definitely would agree with that. I would say, I take a lot of pride in being a nurse, and I think many aspects of the healthcare profession, just like Ftazia said, it's all about helping people. And so there's times when you have to put yourself aside and think of somebody else. And that's every day when you're in healthcare, and especially in nursing. I think, if you enjoy like science, if you enjoy the medical aspects of it, if you enjoy that sort of thing, if you like the idea of being right at the bedside with the patient, nursing might be for you. And it's all about helping people, but that's kind of that aspect of it. And I love being a nurse. Like I said, I can't imagine doing anything else. And I feel like it has only grown me as a person, and I love it more and more the more experience I get in it. So yeah, definitely think hard about that.
Definitely go be a nurse or a social worker, 100%. Yeah. No, honestly, like healthcare is an amazing industry to work at. As technology grows, as like challenges and capabilities grow, I think healthcare is one of the industries you can be the most impactful. Just literally making difference in people's lives, and you can actually like feel that, even though you're working as a business unit, as a kind of like in the technology field, you can actually feel that the things you do have a direct impact on people's lives. I'd say if you're curious about how things work systematically, or if you find yourself asking a lot of why things are done the way they are, or how can I use the great capabilities we have today in the consumer world, right? Your Amazons of the world, right? Take that and implement that into the horsepower of making people's lives better through healthcare. I think this is the best industry to do it. And obviously, like I've been around. Children's is the awesomest place to work at. So, but I'm biased, but it truly is. So come to Children's too.
Well, we're so glad that Dayton Children's rose to the occasion. We've been live streaming since 8 a.m. We've heard from so many incredible Dayton Children's employees, all of you included. Just a special thanks to our three panelists right now, and to everyone who got to talk today for Health Professions Week. There are events all week long. There are videos to participate in. There are a virtual career fair that will be going on later this week. And Miami Valley CTC will have open houses, virtual open houses for students interested into looking at the programs that they have that will be later this year. So just a major thank you to everyone that helped put this together. Deb Jacobs, Casey Hookfin, everyone at the Greater Dayton Area Hospital Association, our friends at my employer, Montgomery County Educational Service Center, and Learn to Earn Dayton, and just all of the schools that joined us today or are watching this in the future. We appreciate you spending time learning about careers in healthcare. And we're gonna sign off, but we'll have panels shortly this afternoon about careers in the military and how you can get into medicine through the military. And then on Thursday, we'll be talking with a panel of leaders from Sinclair College, talking about how you can go and pursue a career in healthcare at a local institution like Sinclair. So don't hesitate to follow the links in the chat that will lead you to all sorts of great resources. And again, thank you to our panelists. And you all have a wonderful rest of your day. Thank you so much.
Thank you.